Today's topic is the Sustainable Development Goals. What are they and why do they matter? So I'm going to invite Patrick first to comment on what the Sustainable Development Goals are, but which ones really matter the most?
Thank you. So there are 17 of them and they are very broad, but the third one about health is about ensuring healthy lives and to promote well-being for all ages. And out of the many targets, there are 4 of them that are really very important for this course audience. The first one is about the reduction of global maternal mortality. Okay. Second one is about the prevention of childhood deaths before the age of 5. Mm-hmm. The third one is about the ending of the epidemic of communicable diseases like HIV/AIDS, tuberculosis and malaria. Mm-hmm. And the fourth one is to reduce by about 1/3 premature mortality from non-communicable diseases.
Wow, so those sound like quite a number of goals. Are there any others that we should be aware of for the course?
There are many goals, but I think the most relevant other goal is in goal 17, improving health, or broadly, improving information systems.
So I'm going to take us back through history now a little bit because the Sustainable Development Goals actually have a predecessor, and they are the Millennium Development Goals, or the MDGs. We had 9 of them, and we have just wrapped up reporting on those. And so I'm going to invite Prabhat to reflect on 1 or 2 lessons from the MDGs and reporting on them that come to mind.
I think a positive lesson is that the MDGs accelerated declines in child mortality. Mm-hmm. John MacArthur has done a nice paper which estimates at least 8 million more children were saved because of attention that the MDGs brought. A less than positive lesson is the need to have data drive goals and not the other way around. Mm. And that's illustrated by what happened with malaria. The WHO had declared that they were meeting the malaria goals for 2015. In 2010, we inconveniently showed that, in fact, there were a lot of adult malaria deaths in India that weren't accounted for in the WHO statistics. Right. And now this led to quite a fierce debate. We were on BBC arguing with WHO about these numbers. The lesson I take is that had the world better estimates of actual malaria deaths in children and adults, WHO's goals would have been adjusted accordingly.
Okay, and Patrick, is there a lesson that comes to mind when you think about the MDGs?
Well, one of the key lessons has been that for the global monitoring, to understand the levels and the trends of a lot of these indicators, you need good data, good mm-hmm. country data, and if possible, timely and of quality. For many countries, a lot of these data quite often are missing or have deficiencies. So quite often some models are used to make some assumptions. And we know from this experience that nothing replaces good timely data, and countries who are able to collect this data can really benefit out of it.
To zoom down at the country level, the countries all have to report on the SDGs, but what kind of capacity will they need? And for some cases, countries are not created equally, they have varying capacity, so where do they start? Patrick, where do you think they need to start to build capacity?
Well, the first one is to get good manpower, skilled manpower to do a lot of this work, to get the resource to sustain it, and to take advantage of existing systems, like, for example, the health systems, to strengthen them and to collect useful information out of it, and to be able, for example, to register births, deaths as they occur, to get this information analyzed and to use it for local decision making, for example.
Okay, those are good. And I would add woman power as well, just to be fair. I know that Prabhat may have some other thoughts about what capacity needs to build at the country level.
I think a starting point is to strengthen all the census operations in every developing country. Okay. The censuses are the heart and the base for all of the other statistics that come along. And importantly, the people who do the census are the statistical offices that need to be strengthened so they can do other functions, so that they can count the dead, they can describe the causes of death through home surveys or through hospital facility data. And in India, for example, all of these key functions are in one office. So strengthening that office will mean that overall health systems are improved as well.
Okay, that's a really very illustrative example at a country level. So let's zoom back out from countries and look at what the global institutions can do to help us deliver on the SDGs and to strengthen health information systems, but in particular mortality systems. So Patrick, little birdie told me that you work for one of these UN agencies. What do you think global institutions like UN agencies can do in this respect?
Well, the first one is to assist countries to strengthen their capacities and to mobilize resources, to provide expertise. And for example, with around 2020, you will have a new round of censuses that many countries are going to conduct, and some assistance, some help, some guidance will be useful to succeed in undertaking many of these censuses, because they are going to be able to provide not just country information, but also local information on many indicators that are monitored through the SDGs.
So that sounds like a very time-sensitive recommendation, given that 2020 is just around the corner. I know, Prabhat, you've done a fair bit of work. Are there some concrete examples that come to mind in terms of recommendations for our WHO and other UN agencies?
Well, I think if Dr. Tedros at WHO were listening, I know he's not going to take the course, but if you were listening, I think a priority for WHO should be by 2025, have in every country a basic system, either complete or in a sample system, or on a sample basis, that counts deaths, count births, and describes the causes of death. And that would be the system that is needed for achieving the goals that Dr. Tedros has outlined, which is universal health coverage. And that would be the system that's needed to monitor successfully the SDGs, not relying exactly as Patrick has said on the problematic models, but on actual data for each country.
And I think WHO is well positioned to do that. Wouldn't you agree?
Yes, WHO doesn't have money, but it has ideas. And the ideas really are the important thing here.
So they can be a real norm setter and technical standard setter. So I'm going to wrap up our panel just with one final question. So at the country level again, not all countries may see the benefits of strengthening their health information systems, given all the competing priorities they have to deal with. So what are the benefits of strengthening health information systems, and in particular mortality information systems? Patrick, would you like to start?
Yes, so thank you. In this context, you have at least two good reasons why. The first one is to understand the situation today in a given country. Where are the needs? What population have the greatest needs? Where in the country eventually some of these challenges exist, and who could benefit the most of various type of interventions? And the second one is to understand the changes over time, and to have a good baseline to understand if you are making some interventions, whether they work and where they are successful.
Okay, and Prabhat, do you have some benefits that come to mind if you were to have to sell this at the country level?
Well, I think what Patrick has outlined is exactly right, and we can illustrate that by looking at the impact of the Million Death Study recently on India's child health programs. So in the paper that was just published in The Lancet, we showed that India has already saved about 1 million more kids than it would have otherwise because of progress since 2005. But importantly, it's concerned about what India can do for 2030. And the Million Death Study has shown very concretely that there's about 225,000 avoidable deaths from pneumonia, diarrhea, measles, and malaria. It's shown that term birth weights with low term births with low birth weights are a priority, and has also identified that India could launch elimination programs for deaths against deaths from measles or deaths from tetanus.
Okay.
So those are concrete examples of what the government at the national level can do. And now those results are being taken down to the state level so that each state of India can plan what they should do moving forward to 2030.
It sounds like very practical planning information. So I want to take this opportunity to thank both Prabhat and Patrick for sharing their thoughts and helping us to begin to demystify the SDGs, how we've learned from the MDGs, but also to focus in on how we can strengthen health information systems. Finally, at the next class, what we're going to cover are the Sustainable Development Goals as they apply to Canada. Canada is not off the hook when it comes to the SDGs, and we'll be focusing on its relevance to Canada and the Indigenous context. Thank you.